Hello and welcome. In this video, we will explore how insights from Eastern traditions and modern psychotherapy meet, where they support each other and where careful balance is needed. There's no rush here. Take your time and let the ideas unfold slowly. Thank you for being here. Two traditions, one question. Across centuries and cultures, human beings have asked the same essential questions. Why do we suffer? How can suffering be understood? And how can it be relieved without denying the depth of human experience? Modern psychotherapy and Eastern contemplative traditions emerged in vastly different historical and cultural contexts. One developed within the framework of Western science, medicine, and individualism. The other evolved through philosophical inquiry, spiritual practice, and communal wisdom. For a long time, these traditions appeared to stand apart, even in opposition. Western psychology focused on diagnosis, intervention, and change, while Eastern traditions emphasized awareness, acceptance, and insight into the nature of mind. Yet over the past century, these two approaches have increasingly converged. Beneath their surface differences lies a shared concern: the alleviation of human suffering through understanding the mind. This essay explores how Eastern traditions, particularly Buddhism, Taoism, and Hindu philosophy, intersect with modern psychotherapeutic approaches. It examines not only where they align, but also where tensions remain, and why these tensions matter for contemporary mental health practice. Suffering as a starting point. One of the most striking parallels between Eastern philosophy and psychotherapy is their shared starting point: suffering. In Buddhism, the First Noble Truth states plainly that dukkha, often translated as suffering, dissatisfaction, or unease, is an inherent part of human existence. This is not presented as a pessimistic claim, but as a realistic observation. Life includes loss, impermanence, and emotional pain. The task is not to deny this reality, but to understand it deeply. Modern psychotherapy, particularly since the late 19th century, begins from a similar observation. Freud's earliest writings were not concerned with happiness, but with neurosis, anxiety, and psychic conflict. Human beings suffer not only because of external events, but because of internal tensions, unresolved experiences, and unconscious processes. Both traditions resist the idea that suffering is merely accidental or pathological. Instead, suffering becomes meaningful, a signal that points towards something that requires understanding. The concept of the self, fixed or fluid, a central point of divergence and later convergence, lies in how the self is conceptualized. In many Western psychological models, particularly early ones, the self was treated as a relatively stable entity. Freud spoke of ego, id, and superego as structural components of personality. Even later humanistic approaches assumed a core self that could be discovered, healed, or actualized. Eastern traditions, by contrast, often question the very existence of a fixed self. In Buddhism, the doctrine of anatta suggests that what we call the self is a dynamic process rather than a stable essence. Thoughts, emotions, sensations, and identities arise and pass away. Suffering emerges when we cling to these transient processes as if they were permanent. This idea initially clashed with Western therapeutic goals, which often aimed at strengthening the ego or building a coherent identity. However, contemporary therapies have begun to integrate a more fluid understanding of selfhood, acceptance, and commitment. Therapy, for example, encourages clients to see thoughts as events rather than truths, echoing Buddhist mindfulness practices. Similarly, mindfulness-based cognitive therapy teaches clients to observe mental states without identifying with them. What emerges is a subtle but profound shift. Healing does not always require fixing the self, but sometimes loosening one's grip on it. Awareness versus control. Another major point of convergence concerns the role of control. Western culture, and by extension much of Western psychology, has traditionally emphasized control. Controlling symptoms, managing emotions, correcting distorted thoughts. Cognitive behavioral therapy, one of the most influential therapeutic approaches of the 20th century, focuses on identifying and restructuring maladaptive cognitions. Cognitive behavioral therapy, change through understanding thought. Cognitive behavioral therapy, commonly known as CBT, is one of the most influential and widely practiced forms of psychotherapy in the modern world. Its appeal is easy to understand. CBT is structured, it is teachable, it is research-based, and it offers clear tools for reducing psychological distress. At its core, CBT rests on a simple but powerful idea. The way we interpret situations shapes how we feel and behave. This insight, though often associated with modern psychology, is not entirely new. Philosophers such as Epictetus already observed that humans are disturbed not by events themselves, but by the meanings they assign to them. In this sense, CBT stands at the intersection of ancient philosophical insight and modern clinical science. The cognitive model, thoughts as mediators of experience. CBT proposes that emotions and behaviors are not directly caused by external events, but by automatic thoughts and underlying beliefs. For example, two people experience the same setback. One feels discouraged but recovers. The other feels hopeless and overwhelmed. The difference lies not in the event, but in interpretation. CBT helps clients identify habitual thought patterns, recognize cognitive distortions, examine assumptions, and test alternative perspectives. This process is collaborative and active. The therapist is not an authority who interprets meaning, but a guide who helps the client investigate their own mental habits. In this respect, CBT emphasizes agency and clarity, CBT and the promise of control. Historically, CBT emerged in response to approaches that were perceived as too abstract, unstructured, or slow. Aaron Beck, one of CBT's founders, sought a method that was practical, observable, and effective. CBT therefore carries an implicit promise. If you learn to think differently, you can feel differently. This promise has helped millions of people reduce symptoms of depression, anxiety, and other disorders. For many clients, CBT offers relief, structure, and a sense of mastery over previously overwhelming experiences. However, this emphasis on control also reveals a limitation. Not all psychological suffering can be resolved through cognitive correction. Some experiences are not distorted interpretations, but accurate responses to loss, trauma, or existential uncertainty. Here, CBT reaches its boundary. CBT in Eastern traditions, a point of tension. From the perspective of many Eastern traditions, suffering does not arise primarily from incorrect thinking, but from attachment to thinking itself. Buddhist psychology, for example, does not aim to replace negative thoughts with positive ones. Instead, it invites practitioners to observe thoughts as transient mental events. From this viewpoint, the attempt to change thoughts may unintentionally strengthen identification with them. This creates a subtle tension. CBT asks, is this thought true or helpful? Eastern traditions ask, do I need to believe this thought at all? Both questions can reduce suffering, but they operate at different levels. When CBT works well, and why? CBT is particularly effective when thoughts are rigid and repetitive, interpretations are clearly exaggerated or catastrophic, clients benefit from structure and clarity, problems are circumscribed and current. For individuals overwhelmed by anxiety or depressive rumination, CBT can interrupt harmful cycles and restore functional capacity. In such cases, challenging thoughts is not denial, it is relief. CBT also empowers clients by teaching skills they can apply independently. This educational component aligns well with modern values of autonomy and self-efficacy. Where CBT encounters its limits, CBT becomes less effective when emotional pain is rooted in early attachment trauma. Distress is primarily somatic rather than cognitive. Suffering relates to meaning, identity, or grief. Clients experience shame rather than distorted thinking. In these contexts, asking clients to reframe thoughts may feel invalidating. The problem is not irrational thinking, but unprocessed emotional experience. Eastern traditions remind us here that insight without compassion can become another form of pressure. Modern psychotherapy responds by integrating CBT with relational, somatic, and mindfulness-based approaches. The evolution of CBT toward acceptance and awareness. CBT itself has evolved. Later developments, often referred to as third-wave therapies, reflect a growing awareness of CBT's limitations and strengths. Approaches such as mindfulness-based cognitive therapy, acceptance and commitment therapy, dialectical behavior. Therapy retains CBT's clarity and structure, but soften its emphasis on control. They shift the goal from changing thoughts to changing the relationship with thoughts. In this sense, CBT does not stand in opposition to Eastern wisdom. It stands at an earlier developmental stage of integration, CBT revisited through an integrative lens. When viewed through the lens of Eastern traditions, CBT can be understood not as wrong, but as partial. It addresses one layer of suffering, the cognitive layer, effectively and ethically, but deeper layers often require presence instead of correction, compassion instead of disputation, relationship instead of technique. A mature psychotherapy does not ask which approach is right, but when each approach is appropriate. CBT becomes most powerful when it knows its place, when it is used as a tool, not as a worldview, toward complementarity rather than competition. The future of psychotherapy does not lie in choosing between CBT and contemplative awareness. It lies in discerning how they can complement one another. CBT offers clarity, Eastern traditions offer depth. CBT offers structure, Eastern traditions offer spaciousness. Together, they remind us that healing is not a single process, but a layered one. CBT teaches us that thoughts matter. Eastern traditions teach us that thoughts are not everything. Between these two insights lies a balanced understanding of the human mind, one that neither over-identifies with thinking nor dismisses its power. In this space, psychotherapy becomes not a battle against the mind, but a conversation with it. Eastern traditions often take a different stance. In Taoism, the principle of Wu Wei, often translated as non-doing or effortless action, suggests that forcing change can create resistance and imbalance. Instead of controlling experience, one aligns with its natural flow. This does not imply passivity. Rather, it reflects a different form of engagement, one rooted in awareness rather than domination. Modern psychotherapy has increasingly recognized the limits of control-based approaches. Research on anxiety and trauma shows that excessive attempts to suppress thoughts or emotions often intensify them. Mindfulness-based interventions, inspired directly by Buddhist meditation practices, encourage clients to observe experiences without judgment. This stance often leads to a paradoxical reduction in distress. Here, Eastern wisdom offers a corrective to Western overemphasis on control. Sometimes healing occurs not through effort, but through allowing the body as a bridge. One of the most significant meeting points between Eastern traditions and modern psychotherapy lies in the recognition of the body. In yoga, qigong, and Zen practice, the body is not separate from the mind. Posture, breath, and movement are integral to mental clarity and emotional balance. Psychological insight is embodied, not purely cognitive. Western psychotherapy long neglected the body, focusing primarily on verbal insight and intellectual understanding. However, trauma research in the late 20th century challenged this separation. Clinicians like Bessel van der Kolk demonstrated that traumatic experiences are stored not only as memories, but as bodily patterns, muscle tension, autonomic responses, and sensory fragments. Somatic therapies such as somatic experiencing and sensoromotor psychotherapy now explicitly integrate bodily awareness into treatment. Breathing techniques, grounding exercises, and mindful movement resemble practices found in Eastern traditions, though often reframed in secular language. The convergence here is striking. Both traditions recognize that healing cannot occur solely through thinking. The body must be included as a site of memory, emotion, and regulation. Compassion as a therapeutic force. Compassion occupies a central place in many Eastern philosophies. In Buddhism, karuna, compassion, is not merely an ethical virtue, but a practice that transforms the mind. Compassion toward oneself and others reduces suffering by softening rigid patterns of judgment and aversion. modern psychotherapy has increasingly validated this insight. Research on self-compassion, particularly by Kristen Neff and others, shows strong associations between self-compassion and psychological well-being. Compassion-focused therapy explicitly targets shame and self-criticism, recognizing them as major sources of distress. What both traditions suggest is that insight alone is insufficient. Understanding one's patterns does not automatically lead to healing. Without compassion, insight can even become another tool of self-judgment. Compassion provides the emotional safety necessary for change to occur. The therapist and the teacher, despite these convergences, important differences remain, particularly regarding the role of the guide. In traditional Eastern contexts, the teacher-student relationship often carries spiritual authority. The teacher is seen as someone who embodies insight and transmits wisdom through presence as much as instruction. This dynamic can foster deep trust, but also carries risks of dependency or idealization. Modern psychotherapy, shaped by ethical guidelines and power awareness, emphasizes boundaries and collaboration. The therapist is not an enlightened authority, but a trained professional who supports the client's autonomy. As Eastern practices are integrated into psychotherapy, this distinction becomes crucial. Mindfulness, for example, must be taught in ways that respect psychological vulnerability and avoid spiritual bypassing. The use of spiritual concepts to avoid emotional work. The integration of traditions therefore requires not only theoretical alignment, but ethical sensitivity. Conclusion: a dialogue, not a fusion. The relationship between Eastern traditions and modern psychotherapy is not a simple merger. It is an ongoing dialogue, one that enriches both sides while revealing their limitations. Eastern philosophies offer depth, patience, and a profound understanding of impermanence and awareness. Western psychotherapy offers structure, empirical grounding, and ethical frameworks for care. When thoughtfully integrated, these approaches can complement one another, offering a more holistic understanding of human suffering and healing, yet integration must remain critical and reflective. Not every Eastern concept fits seamlessly into therapeutic contexts, and not every Western intervention aligns with contemplative wisdom. The goal is not synthesis for its own sake, but responsiveness to human complexity. CBT teaches us that thoughts matter. Eastern traditions teach us that thoughts are not everything. Between these two insights lies a balanced understanding of the human mind, one that neither over-identifies with thinking nor dismisses its power.